Hi, today I'm going to talk about Pdrns. Pdrns are actually pretty remarkable molecules. I had the pleasure of presenting a talk at the 40th anniversary of the AACS scientific meeting. And for preparation in that talk, I did a deep dive into the literature on Pdrns. So let me first tell you what Pdrns are. Pdrns is a proprietary and registered DNA derived drug, and it is manufactured from salmon DNA. It's purified at very high temperature, so you get about 95% pure substance. This eliminates the impurities, so you have decreased risk of immune response. And what this molecule does, it actually binds to a receptor in the cells called the adenosine A2A receptor. Once it binds this receptor, it actually performs a cascade of events. So I'm going to highlight what the most important events are. Okay, so when this molecule binds the receptor, you're going to get an increase in anti-inflammatory cytokines, which are proteins that mediate inflammation. It also decreases inflammatory cytokines, so it creates an environment where there's less inflammation. It also increases growth factors that are responsible for increasing blood vessel formation. And so one of the most important growth factors that it increases is vascular endothelial growth factor. So you have decreased inflammation and you have increased vessel formation. And it also has been shown to increase fibroblast production, to increase chondrocytes, which are the precursors for cartilage, and also osteoblasts, which stimulate bone growth. All of these chemical reactions, you get regenerative growth. And the other important mechanism that occurs is called the salvage mechanism. Now this was, this was discussed by Sini, S-I-N-I, in 1999. So the studies go back to the 90s. And what he did is he actually studied cultured fibroblasts, which produce collagen. And he put radioactive DNA in there. And so what he found was that the damaged DNA cannot replicate and repair itself, and so the healthy DNA from the Pdrns are incorporated into the damaged cells and they're able to replicate. So this is how all the cells are able to repair themselves. And in looking at the literature, I found that there was quite a few studies on regenerative medicine, wound healing studies, and Pdrn increased and improved wound healing by these mechanisms. So we have studies that show diabetic ulcers that were healed quicker with Pdrns. We have literature that shows that stasis ulcers also heal, and inflammatory conditions like arthritis is also improved. All right, let me talk about the cosmetic applications of this molecule. As we know, most substances start with medical use, just like PRP, and then it makes its way into the cosmetic arena. Well, Pdrns are no different. So what they found is that the decreased inflammatory milieu that this produces in the cells is very important for cell health and decrease aging. And it also has been shown to decrease a very specific protein called MMP, matrix metalloproteinase, which actually has been shown to break down elastin fibers. So it decreases elastin degradation. All right, it's also been shown to decrease tyrosinase activity, and that's the limiting enzyme in melanin production. So it's actually useful in hyperpigmentation states like melasma. And it has been shown in studies to also promote hair growth. So patients that have androgenic alopecia, which is the most common form of hair loss that we treat in aesthetics, can be treated with Pdrns. It also has been shown in a study out of China, which was published in about 2021, to increase fat. So they actually harvested fat and put it in rabbit ears and actually tested it with two other compounds, botulism toxin and prostaglandin in a control. And what they found was really interesting, that the graft that had exposure to the Pdrns was increased in size, so it had the most weight, and it also had good vascularity. So the Pdrns, interestingly, stimulate fat to grow, and it's been shown in a study to stimulate pre-adipocytes, which are the cells, which are the precursors to the adult fat cells. And I want to talk a little bit about how I use the Pdrn by itself in a more purified fashion, and also in combination with two other compounds, specifically PLLA and HA. So in the Pdrn that's more purified, I like to use it as a potent skin booster. In that one, I inject just underneath the dermis with the cannula, and I get a good stimulation of elastin and collagen, because it does stimulate the fibroblasts to produce new collagen, and also stimulates elastin formation. And I also use it for skin boosting in the neck and in the hands. I actually have also used it to repair damaged skin from a resurfacing procedure, and the patient had scarring, and I was able to reverse the scarring in the dermal area, and she basically, using the salvage mechanism, reproduced her cells and produced new collagen elastin, and actually repaired her dermis. And then I lastly use a system that has two other components. It has the PLLA, which is polyallolactic acid, and it also has an HA. These three components, I actually love to use it as a biostimulator. And what I do with these three with this system, when I mix the components together, I actually inject them just like I would fat, knowing that the Pdrns stimulate the fat to grow. So I basically do a global volumization of the face and put the system wherever volume is needed. And what it does, it actually creates volume by stimulating the fat to grow, stimulating collagen and elastin, and it also promotes cell health, and the skin looks more vibrant and healthy.